Hello! In this video I will be introducing and briefly describing goal-focused therapy. Goal-focused therapy is a client-led, person-centred therapy which aims to empower the client to create goals around their own recovery. It is a practical approach to therapy which uses goal setting as an integral part of the recovery process. Goal-focused therapy is broken up into 3 sections of 6 sessions each. After each 6-session block, there is a review session, which is a time to speak about how you think the therapy is going, whether you think it's working for you, and you'll be asked to complete some progress monitoring documents, which just show us what's going on inside your brain. Every 6 weeks, you'll also be provided with the chance to modify anything that we're doing. If you feel that exposure would work sooner rather than later, we can also change that. It aims to improve your self-esteem by reversing the damage caused by eating disorders and re-scripting the way you speak to yourself. A lot of people with eating disorders really struggle with negative self-talk, so in goal-based therapy we aim to fix that by introducing some positive self-talk and to get your self-esteem back up where it should be. So the kind of support that is offered is self-esteem and self-care work. So that's goals based around saying nice things to yourself in the mirror, doing more self-care activities, doing more things with friends so that the blockage created by the eating disorder can slowly be undone so you feel like you can be more social again. There's also a lot of psychoeducation to understand that predisposing factors and neurobiology involved in eating disorders, and understanding the effects of the eating disorder, how the effects it's having on your body, your brain, your social life. The exposure work is also an absolutely integral part of goal-based therapy. Exposure work can take place in many ways, but some of the common ways that we can do exposure work is through meal planning, food shopping, and going out to eat in environments or eat foods that had previously worried you. The way that the exposure work happens is that we go into an environment which would usually cause quite a spike in anxiety, but your body can't maintain the level of anxiety for very long, so it eventually comes down and you realise that actually there's nothing to be worried about. We'll carry this on throughout the sessions doing different exposure works, and exposure work makes up quite a lot of the homework as well. It's proven to be very useful in breaking down some of the barriers that the eating disorder can set up around you. Part of the exposure work can also be being weighed. Some people prefer not to be weighed, they never want to step on a scale again, and that is absolutely fine. Sometimes being weighed really helps with disproving the rules that the eating disorder gives you and catching it out in some of its lies. So you may have the impression that you're going to gain 10 stone in a week, so we can disprove that by weighing you. However, it is absolutely not compulsory part of the therapy. Both adults and adolescents with any of the following eating disorders, so any restrictive type eating disorders, anorexia, ARFID, or binge eating disorder, or bulimia, all working within food, meal planning and exposure therapy. We can also work with your family. Family work can be incorporated into the goal-focused therapy model if there is a particular conversation that the client would like to have with the family, or parts of the therapy which could be improved by family input. So that's if you still live at home and you need some help with your food preparation, maybe you need your parents to be involved in some of the goals. For instance, if you're going out somewhere, you need them to take you. Also, if there is an event coming up which family is an integral part of, such as Christmas, that you might want to discuss with your family. During goal-focused therapy, you'll be asked to make a goal each week, which then makes up your homework for the week. This will be supported by the therapist through email, so although the homework will be done solely by you. It'll be supported by the therapist through email at any point during the week if you're struggling. The therapist can also be contacted if the client is needing some extra motivation during the week, if they're having a particular dip, or if they just want some advice over a particular situation. So we hope that this short video has provided you with some information about goal-focused therapy. If you do have any questions, please feel free to contact us on info@saida.org.uk or call the office on 0114 272 8822. Alternatively, you may find some of the answers to your questions on the self-help section of our website.